So today I'm going to talk a little bit about how to increase your case acceptance for periodontal disease, which is by far for me the hardest to get case acceptance for, because a lot of times with that there's not any symptoms involved, so we have to create the emotional button for that. And also how to increase new patients coming in wanting you to help them with their periodontal disease. So a few things, for this, because usually with periodontal disease there's no symptoms, they've been sent to you by their dentist because of this disease. The dentist probably has been trying to control it for a little while, or the patient's noticing something that's odd and it's resulting from the periodontal disease going to a whole new level. So how do you do this? First of all, when you do have your patients come in, you do your probing, you do your x-rays, you do your photos, you create your data, and you have to educate that with the patients. So what do we do here? We do our data collection and we share that with the patient. How do we share that with the patient? So we will go over their x-rays to say, let me show you your x-rays. Let me show you where the bone level is supposed to be, and look at where the bone level is on this tooth that is being affected by this periodontal disease. So show them on the x-rays, because just showing them their x-rays or just having them posted up on top doesn't really show them anything. They don't know what that is. So show them where the bone loss is, where the furcation is, and what it's doing. Not just where it is and what and how it looks, but what is it doing? It's taking away all that bone support from around the tooth. That's why the tooth are starting to become a little loose. And what's going to happen with periodontal disease is it's going to keep getting worse. It doesn't stay the same. It doesn't get better. It continues to get worse until that tooth will come out of your mouth. Educate that. Show them the perio charting. Show them on the charting the red, where the red is, and show them it's red because it's pointing out what's not supposed to be there. So you have your different perio chartings, show them that the normal pocket is supposed to be 3, but they have 5s and 6s and 7s and 9s and 13s on that sheet. And then you have to educate a little bit about what periodontal disease is and the different grades. Where are they? Show them where they are on here. And we've taken some of these papers that I'm going to show you, and we put them into a PowerPoint, and we sit with our patients and we're showing them this. We're sitting in front of them and we're showing them because we want to educate them. Now, I just posted a video not too long ago that Dr. Sheldon had made to show his patients, because he's the one that sees the new patients, and he did this to educate them a little better on the disease. And it says the body wants to heal. So look for that video back in your emails to see the video we made. You can do straight PowerPoint and talk over it, or you can do a video and have it already talking. You can use our video, I don't care. But definitely want to show them that. We talk about how it is a systemic disease. It's an all over body. The mouth and the body is connected, and when they have this disease and they're swallowing their saliva and they're eating and everything is going through, it's in their bloodstream, and they don't understand this. So you need to educate them and show them that this is a whole body thing. What does that do? The periodontal disease does increase their risk for other medical conditions. We've had patients come in that we go over this with them and they say, I just was diagnosed with high blood pressure. I was just diagnosed with a mild form of Alzheimer's. So this all goes together, and your patients need to know this. If you don't tell them, they won't know. They need to know. They need to know about Alzheimer's, the link between Alzheimer's and periodontal disease. They need to know this. So share it with them. Put this on your slide. They need to know the link between heart disease and gum disease. Put this on your slide. They need to know. All these have the research, the journal research on there, so they know you're not just saying it for a scare tactic. It is something that is linked together. And then you talk about how we are going to cure it. We use the periscope. You guys might use different lasers or different things that you do, and that's fine. But just educate how your system works and how it's effective and what you do for your patients to cure them, to rid them of this periodontal disease. And most importantly, you want to share with them that this is a transmissible disease, that this is contagious. Why? Because you can treat your patient and you can get your patient better. But if they keep kissing their husband, it's going to come back. If their husband has it as well. So you definitely want to talk to them about that, and you want to say that this is a transmissional disease, that it is contagious, that you are going to treat them and you are going to do all you can to get them rid of this disease. And that also goes with the education. That also goes with the period maintenance. That also goes with home care, lifestyle changes, all that. Yes, we can help you, patient. But if you're going to go home and keep kissing your husband or your significant other, then we can only do so much. It's going to reoccur. So this is where you can increase your new patients that are coming into your office. We offer a free spousal exam. We want you to bring your spouse in. We want to do the same examination we did on you today with your spouse or significant other, because we want to make sure that if you're going to spend this money and this time to take care of this periodontal disease that you have, you want to make sure that your significant other is not keep giving it back to you. So we want him to come in. We're going to do the same exam, same stuff. We do a complimentary spousal exam. Some people do, a significant discount for that, whatever you want. But your patients get very excited about this. They say, yes, I'm going to schedule him today. I'm going to schedule her today. I've got to do that, because you want to make sure you're taking care of the whole family in there together. We had a case not too long ago of two sisters. They lived together. They drank after each other. They were in their 20s, and they had probably the worst case I have ever seen. You want to get them into your office. You want to take care of them. So do talk about that and offer a spousal examination, offer a family examination. Talk to them about that. Talk to them about how they can prevent this from reoccurring. And that is transmissional. So it is their husband, their wife, their significant other, boyfriend, girlfriend, whomever. It might be a sister or a roommate who drinks after them. Diet, water intake, fruits and vegetables, stress, sleep, smoking, all these things as well. And I say this, and not because I don't think that you know this. I know that you know this, but sometimes we get so numb to the routines of what we do that we forget how important it is to educate our patients on this. They don't know. Sometimes I have patients in their 70s or 80s that think drinking a whole pot of coffee is like having a whole pot of water to drink. It's not the same. So we need to educate them, and we need to make them healthier, because we do want them to be healthy. We do want their body to heal. So look for that video if you want to see the video that we made on it. But just a good idea for you, go on ahead and do your examinations, educate your patients on what the disease is. Also educate them on, if they do not take care of it, it's not going to stay the same. It is going to get worse, and it will take their teeth, and sometimes it can be even worse because of the research out there that says the links to medical issues is there. Let them know that. Talk to them about that, and get their significant other in to your office for a no charge or reduced fee for the examination. That way you have now a patient that you can keep on your hygiene schedule, and another patient you can add to your list. That is your patient. It's not a referred patient, so you can keep that patient and refer it to one of your favorite referral sources. Any questions on this, you can please email me at danielle@directordentistry.com. I would love to help you with more ideas on how to increase your new patients and also help gain more case acceptance. Have a great day.